We're going to start on chapter 1. Make sure you read the chapter. It's important to read each chapter before you attempt to do the quizzes, and you need to actually probably do them with the textbook right beside you. All right. So, and each quiz that we have will be cumulative, so that each one builds on the first one, builds on the second one, builds on the first one, the third one builds on the second one and the first one, and it continues on throughout the semester. Welcome to Pathophysiology. So the first thing up is health and disease. So health is the physical, mental, and social well-being of a person. And then disease is when we have a deviation in that normal state of homeostasis. And we all know homeostasis is maintaining the values of our body within a certain set point in that normal range. So we can look at some health indicators to determine whether someone is healthy or not. So we have these normal values, and they actually are ranged. We wouldn't say anybody had a fever because they were 98.7. So there is a normal range. Even though the normal value is 98.6 degrees Fahrenheit, 98.7 is not a fever. And the ranges may vary depending on the technology used to take the measurement. We also need to make adjustments based on age. So an infant is going to have a little bit different normal values than an elderly person. There are some differences in gender. So, for example, the hematocrit, we would expect a male's normal range to be a little bit different than the females because of the menses. Genetics can influence this, the environment, and also the activity level, whether somebody's sedentary or if they are more active. There are 7 basic steps to health. This is what it kind of takes to what you call live a healthy lifestyle. The first one is to be a non-smoker. So smoking is a very negative impactor of health, and also avoiding secondhand smoke. Eat a well-balanced diet with lots of fruits and vegetables, high fiber, low fat, and limit alcohol intake. And that is going to be dependent of the recommendations are going to be based on gender there. Physical activity on a regular basis, 3 to 5 times a week. Protection from the sun, so wear sunscreen or a hat whenever you're out in the sun. Also follow cancer screening guidelines based on age and risk factors. So certain things like mammograms and prostate exams and colon exams. Follow up with your doctor or dentist if there's any abnormal changes in health. So when you're sick, go to the doctor and get treated. And also follow health and safety guidelines at home. So read the back of the labels and don't drink Clorox, those types of things. So follow the health and safety guidelines at home and at work when using hazardous materials. So what is pathophysiology? Pathophysiology is the functional changes in the body as a result from disease. So there's some kind of disease, and it's going to change the physiological or functional outputs and things. There's actually changes in the body. It uses both anatomy and physiology because we need to know both the structure and the functions of the normal anatomy and physiology. It also includes things like pathology, which describes changes in tissues caused by a disease. That's pathology. So a pathologist is going to study the tissues. And also we're going to look at cause and effect relationships and how the causes affect the body, and also look at signs and symptoms of a specific diseases. One of the newer things that we look at in disease with pathophysiology and just in general is disease prevention, preventing disease before it happens. And some of the things that we can do in healthcare and in community health is maintain routine vaccination programs. So that is why it's required for children to get vaccinated before they go to school. And for a lot of universities, if you go to and stay on campus, you have to make sure you have update vaccinations. Participate in screening programs. So glaucoma screening, we have them come out. We do their screening for high blood pressure and things like that. Community health programs, and even regular doctor visits, routine doctor's visits that allow the doctor to follow up and keep a track of an individual's health. The next thing up is talk about a medical history. This is important for any kind of health practitioner, is to keep track of the person they are treating's medical history, so they can know to modify or they can change any kind of instructions they have as it goes. So medical history typically follows current and prior illnesses. It tells all the allergies of the patient or the client, hospitalizations, treatment or treatments they're on, and if they have any specific difficulties, and any type of therapy or drugs, prescription, non-prescription, and herbal supplements. Okay. Now, as our medical community has changed over time, we're constantly updating our information and knowledge. We could see that in real life as if we follow the news, how things change. Just because things change doesn't mean stuff's actually wrong. We change, as scientists, we change according to new data and new improved diagnostic tests. So this means that it's constantly improving over time, hopefully. And sometimes we have a step back, but overall, the overall march of science is forward. We also develop more effective drugs and new technologies, and we constantly research in order to prevent, control, and cure other major disorders. This is a really good image of a chart that shows the occurrence of disease. So how does the disease occur in a population? So how does disease occur in a population? So right now we're have the coronavirus, COVID-19 going around, and this is one way we could look at it is through prevalence and incidence. So we're looking at a population of cases per 100,000, and we can look it over at time. So here is the cases per population of 100,000, and here is the months as it goes by. And so what we can see is we have the prevalence, which is the total new and old cases, how many active new and old cases there are, and then we have the incidence, which is the new cases. And we can see as we have a spike of new cases, the prevalence increases. Okay, so the prevalence increases, which is new and old. Epidemic is when we have a large temporary increase in cases. So when there's a large temporary increase. So right now we're in an epidemic, but hopefully it'll level off and calm down in the future. Another thing the first introductory chapter talks about is cellular adaptations. So this is how the cells respond to changes, be they good or bad. These are usually pathological changes, and we can see here the first one is atrophy. Atrophy means there's a decrease in the size of the cells, and since there's a decrease in the size of the cells, there's a reduced tissue mass. And we can see atrophy almost immediately in those patients that are on ventilators, and also as we age, our muscles atrophy. Then we have hypertrophy, which is an increase in size. This can do to various different things. One common thing we can see is when people work out and lift weights, their muscles hypertrophy and they increase in size. The next is hyperplasia, and this is an increase in the number of cells. So the cells are growing dividing more rapidly, and so there's an increase, and that's hyperplasia. Okay, and so we can see here's our normal cells. Atrophy, they get smaller. Hypertrophy, they get larger. Hyperplasia, is there's more of them compared to normal. And we'll talk about the next three here in a second. So, or four. So the next one is metaplasia. This is where we typically would have a mature cell type, say, of epidermal cells on our skin, but now they're being replaced by a different mature cell type. So maybe they're getting replaced by some type of fibrous cell instead of epidural cell. Dysplasia is where we vary in size and shape within a tissue. This is one of the things that a pap smear looks for, is if there's dysplasia of the cells of the cervix. Then we have anaplasia, which is undifferentiated cells, which means they didn't become any kind of mature cell type, and they have variable nuclei, nuclear structures and cell structures. And then last we have neoplasia, which is new growth. Neo means new, and this is commonly called a tumor. So we can see here, we see dysplasia, different cell types. Then we have the metaplasia, the normal cell types here, but now it's being replaced with some other type of cell type. And then lastly, neoplasia, which is the cells are dividing, new cells, and since it's invading another tissue, it's malignant. Okay. Cell damage. So when cells get damaged, a couple things can happen. The first one is apoptosis. This is what we call programmed cell death. It's a normal occurrence in the body. Is where the cells have some kind of damage, and then they purposely die, so that they don't waste resources or keep living and cause problems. So apoptosis is a typical response to cell damage. This cell damage can come from things like ischemia, which is a deficiency of oxygen in the cells, and this could be due to blood flow, or it could have overall the whole system have low oxygen. Then we have hypoxia, which is where we have reduced oxygen in the tissues. So ischemia is not enough oxygen in the cells. Hypoxia is not enough oxygen in a tissue. Okay, very similar. Then we can have physical damage, which can be exposure to heat or cold, or even radiation exposure, where it physically damages the cells. Then we have mechanical damage, which is the act of pressure or tearing of the tissues. And then chemical damage, which can come from the environment or inside the body. So if it's out from the environment, we call that exogenous, which means we probably ingested it or it touched our skin and got inside our body. And then endogenous is when we make things within our body that damage the cells. So a lot of autoimmune responses. Endogenous. We can also have cell damage from microorganisms, such as bacteria and viruses. We can have abnormal metabolites, where we're unable to process things correctly with our metabolism. And then this is going to cause the altered state inside our body and cause cell damage. Things like gout. You think about gout, the buildup of the urea. Also nutritional deficits, where we're not getting enough food and energy, or an imbalance of fluid or electrolytes. They can cause damage to the cells. And if we go back and think about early on when we were learning about fluid levels and hypotonic, you could see how that could damage our cells. And then the last thing we're going to talk about is necrosis, which is the death of the cells that is not programmed. So necrosis. So this is the tissues are dying, the cells are dying, but it's not programmed. So a few different types. The first one is liquefaction, necrosis. This is where the dead cells actually become liquefied because of the enzymes within the cell, and they kind of just eat the cell up and cause it to liquefy. Coagulative necrosis is the cell proteins are altered or denatured and cause coagulation. And then we have fat necrosis, where the fats inside the cells are broken down. And then caseous necrosis, this is a type of form of coagulation where it looks like a thick and yellow cheesy substance. So here's a coagulative necrosis of the kidney. We can see our kidney here and our ureter, and then you can see the cellular damage, how it got kind of yellowish and red. Okay, liquefaction necrosis over in this portion of the brain where the brain tissue actually liquefied, and then fat necrosis in the mesentery, which is, and you can see the fat being kind of digested and liquefied. A couple other types of necrosis where it's just cell death, unprogrammed cell death. One is an infarction. We hear this when we see a myocardial infarction of a heart. It caused from a heart attack, and this is caused when there is a result of oxygen deprivation, and we don't have enough oxygen. And then one of the last ones is gangrene, where the necrotic tissue, the tissue is dead, and then we have an invasion of bacteria, and the bacteria actually start eating the tissue. And this causes the dead tissue, and this will cause an odor and causes the gangrene, and it typically spreads because the dead tissue, the bacteria cause a lot more problems. And here's an image of some gangrene, and this is probably due to some poor circulation in maybe a diabetic patient.